thank you for this short video. So what is your name?
My name is Nan Stegner.
And so you came to Family Holistic Dentistry to get some implants. Why did you choose ceramic implants?
Because I'm chemically sensitive and I don't do well with what the normal dentist would put in. In fact, I just would have gone without rather.
Okay. But you know you needed to replace your teeth.
Mm-hmm.
So those extractions were done long time ago and you were having a breach.
Mm-hmm. Up here I had a bridge and I had decay in the back tooth, and so we decided to check that and see if it had to be extracted or made into another bridge or what. And you recommended, after we found out that I could have had a bridge there because it was not, the decay wasn't as bad as we thought. But we decided not to get a bridge because I would have the same problem of not being able to clean on the inside again.
Yeah,
and
when
eventually
a bridge,
I might have the same problem.
and because the bridge has 3 units, if one fails, the whole bridge fails. And you have a good bone in the area of number 3, which is the upper right, to place an implant.
Yes.
Yeah, so that's why
So we decided on the implant.
an implant, and also on your lower left.
And on the lower left, I was missing one tooth already, and the tooth next to it needed to be extracted. And so because of that, we decided I didn't want to go with two teeth missing there. So I decided on an implant in both spots.
Okay. So, but the main concern that you had to go to implants were because you're chemical sensitive.
Yes, I did not want something put into me that was going to cause troubles.
And then we offered to you the CeraRoot disc, and you tested with that.
I had it tested with a lady who does bioenergetics for me, and also you sent off
the Biocomp. So we they test the serum of your blood, and they tested, and they say that you're fine with CeraRoot. They say the CeraRoot is very biocompatible.
Yes.
So then when we have that clear, we did the surgery. So how was the surgery for you?
The surgery was much simpler than I expected, and afterwards I was blessed. I had no pain.
Oh, okay, that's good.
I did not have pain or swelling, or maybe a slight amount, but for a day.
Yeah.
But nothing.
And then your healing has been really good. So now you're ready for your crowns.
Yes.
So we have a period test -8, which is great. And because you had a good experience with the lower left, then it was easier for you to decide to get the upper right.
Yes.
Yes. And how was the surgery?
Again, the surgery went well, but that night I thought, I'm going to have some pain with this, and I took a little arnica, and I don't remember if I took any ibuprofen. I might have, but I very seldom do that. And the next morning there was no pain. So,
good.
So from there,
I think if you had a lot of pain, you will remember. You know,
yes. No,
I always remember
no
if I had pain, but if I don't have, you don't.
I was surprised that I had no pain, and so was everybody around me.
Oh, good.
People were concerned about me.
Okay, I'm happy
because of the Novocaine, everything. My body doesn't like anything extra.
But it was fine with the local anesthetic too. Oh, good. Happy to hear that. And also, what was your experience with the Essex?
The Essex, they work. They're not uncomfortable in any way, unless if they are, I come here and you file off a little spot and they're fine.
That's
I
good.
hardly know they're there, but controlling myself, eating soft foods was hard for me, but not.
But it's doable.
Yeah, it was
and you
doable.
did great. So now you're ready for your crowns. Okay.
Yeah, I would say, other than the extended time of saying, be careful with the food, be careful what you eat, there's no problem.
Oh, good. And you think CeraRoot implants are good at biocompatible, since you don't feel sick or anything? Actually, you feel healthy?
Healthy, maybe better as far as that goes, yeah.
Oh, good. That's a good thing. Yeah, because, and then now you're ready for your crowns, and the gum is healing amazing. So it's really, I will show you the photos that we took. and it shows that your gum is really happy and your bone too.
And
We took some X-rays too, so I will send you that for you to see and compare. But yeah, thank you so much. Something else that you want to?
I was just going to say, I think there might have been some infection here or up here, and I think that's why I felt better afterwards instead of worse.
Oh,
because
that's
I
good.
think I got rid of.
So you feel better with the implants than before you had the implants?
I think I might.
Oh, good. That's even better.
Yeah.
Okay.
Other than the frustration of the other.
Yeah, because it was a little breaking a little bit, but it's okay. You made it.
No,
Okay.
I did.
Yeah. Thank you so much.
Mhm.